The global challenges in our industry represent at the same time global opportunities. Billions of people around the world do not have access to healthcare or they receive poor quality care.
I believe health insurance coverage is by far the largest challenge. In addition to factors such as economies of scale, accessibility to care, availability and quality of equipment and consumables, lack of human resources, and of course, cultural behavior.
Evercare is a private and integrated healthcare company with 29 hospitals, 16 clinics, and more than 75 diagnostic centers. We operate in developing countries with a specific focus on Asia and Africa.
We are driven by a social purpose to improve lives and transform healthcare in our markets. And we believe it is a universal human right for all individuals to have access to quality healthcare, regardless of race, religion, or economic or social condition. From an environmental standpoint, we focus on minimizing our carbon footprint, reducing our waste, and improving our resource efficiency, something we're very proud of. In my opinion, migration is one of the biggest factors which determines the rapid growth of the healthcare industry in Africa and Asia. Over the last few decades, Africa is witnessing a huge population shift, and more people are shifting from villages and rural areas to cities. Today, cities provide access to a better lifestyle in terms of employment opportunities, healthcare, education, safety, security. And this massive migration of people to cities is what's really encouraging investors to build and open new hospitals and provide people with access to medical facilities, which is what we're doing in Pakistan, Kenya, India, and Bangladesh.
JCI is a very stringent accreditation program. We are the only JCI accredited hospital in the country. Every patient who walks into a facility is assured of quality care. That translates into better clinical outcomes, lower infection rates. And especially in a country like Bangladesh, where people earlier had to travel outside the country to avail of their healthcare needs. Now, when they are able to get the same level of treatment within the country, that's fantastic, and that is what Evercare stands for.
Care Group is the largest investment platform of Evercare Group. Today we have 13 odd hospitals totaling to 2,000 beds in the country. So India actually, as you know, has a larger advantage of its population, and also the fact that it is becoming a global hub for a lot of things, including healthcare, gives us an advantage to reach out to population which does not have access to it outside of India. So I think as an organization, this is a rare quality for an organization to focus on all the strong pillars of the foundation, and together we are able to create a balance which is delivering a larger impact not just to our patients but the society at large.
Evercare Hospital Lekki is strategically located in the heart of Lekki, which is one of the fastest growing communities in Lagos, which in itself is home to over 15 million Nigerians. Evercare Hospital Lekki starts its diversity and inclusion mandate from the recruitment drive, ensuring that we are screening, interviewing, and recruiting candidates that come from a range of ages, genders, nationalities, religions, and worldviews. Over 50% of our senior management team is female, and this cascades down right through the organization, such that 50% of our employee base are also female. Because we believe diverse organizations are more likely to be agile, innovative, and produce the best results, and this has been backed by the data.
The second commonest cause of deaths in Kenya is actually non-communicable diseases. Nairobi Women Hospital is an Evercare company. Evercare is starting in Nairobi Women. Will be trying to screen at least 10,000 patients to make sure we unravel this NCD. This translates more to quality, so the screening is important so that we can put in structures and systems that will support our delivering the services and making sure there's quality outcome. Nairobi Women Hospital has one arm called the Gender Violence Recovery Center. This is the non-profit making and the charitable arm of Nairobi Women Hospital. We have 9 centers spread across the whole country. We've seen more than 46,000 cases of survivors. It's important to understand that most of our survivors undergo very harrowing experiences, and most of them also have very huge scars the rest of their lives. So those cases that come to our hospital, we are capable of making sure that we treat them and also make sure that we give them the interventions that are necessary. We also have a vision as GVRC, and this vision is to ensure that we have a society that is free of gender-based violence. We have a bunch of data in our resource, and this is what we use to advise the government and making sure we have an impact in the care we give. We are very good at ensuring that GBV goes out in the community and ensures that there's awareness so that we don't get these cases happen.
Last year in our hospitals and health centers, we welcomed and cared more than 3 million patients. Our ambition is to double this number in a few years by expanding our footprint and services. For sure, we remain fully committed to the developing countries in Africa and Asia.
Quality is at the core of Evercare's mission. We have a robust clinical governance process being implemented in each market, and we ensure continuous quality improvement and adherence to international standards for ethics and compliance. And we use patient experience as a key metric to measure patient satisfaction so that we can continue to improve our delivery of care. Evercare is in the process of deploying a learning platform and an employee communication app across many of our businesses to really encourage knowledge and best practice sharing. We're also rolling out an enterprise performance management system, and this will help us to analyze and monitor operational and financial performance.
It would be easy for me to say that future is all about technology, artificial intelligence and robotics. However, for us, these are enablers to execute our strategy, which is about bringing quality healthcare to everyone. We want to reach patients everywhere, and technology can absolutely help.
For Evercare, quality in healthcare means providing the care the patient needs when the patient needs it in an affordable, safe, effective manner. We also believe that quality in the healthcare context is a collaborative effort, and it involves the patient, the physician, the nurses, the patient's family, and the community as a whole. And this aligns with our social purpose, which is to give our communities access to value-add, safe, quality healthcare and improve millions of lives.